After spending thousands of dollars on treatments that didn't work, Charles Aseku has decided to take part in Ghana's first ever live trials of Microsoft's 3D telemedicine, all in the hope of getting a permanent cure. Since 2002, Charles has suffered from a keloid, a large growth tissue on his neck. Despite undergoing 2 operations, the keloid grew back.
Normally, when you go to hospital, you will see only one doctor there. But I see a lot of doctors here. And because of that, I'm very happy to see a lot of the doctors because the experience will come from each of them and maybe they will find solution to my problem.
3D cameras capture his image from every angle, which is then transmitted to doctors to assess his health condition remotely. Aseku's session has doctors from Rwanda, Scotland and Brazil. The technology also gives patients in rural areas a chance to be seen by doctors without having to travel for such appointments. 68-year-old George Opoku, a farmer from Koforidua, a village in eastern Ghana, was referred to Accra's Kolebu Teaching Hospital, but traveling to the capital was costly. He has a sarcoma in his armpit, and this appointment saved him money.
I was happy that I didn't have to travel all the way to Kolebu, because it would have been expensive, especially with transportation and accommodation.
For patients like Aseku and Opoku who need reconstructive care, 3D telemedicine gives their doctors a chance to see the growths and plan for surgical care. Engineers working on the Microsoft 3D telemedicine project say once surgery has been carried out, it helps doctors follow up and monitor healing.
So you can rotate the person, you can look at them from any angle, and then you can actually, the doctors in this case, can draw on them and indicate what they're going to do. So it allows them to perform a pre- or post-surgical consult without actually having to travel.
Ahens Sandasebre is not involved in the 3D telemedicine project, but as a senior practitioner at a National Reconstructive and Plastic Surgery Center, he says the technology should be encouraged as it could bridge the gap in healthcare caused by the high patient-to-doctor ratio.
There are a lot of training institutions that are trying to raise a lot more specialists, but looking at the fact that we are behind. Now, if somebody is in a remote part of town where he doesn't have access to these specialist services, but needs it, the referring doctor could actually use this telemedicine thing to get access to the best of care.
Experts behind this technology hope that the trial can show the feasibility of 3D telemedicine in Ghana and eventually lead to it being implemented by more countries. Caroline B., CGTN.